Wisconsin Senator Ron Johnson is taking the Obama administration to court over what he says is special treatment under the health care law for members of Congress and their staffs. Johnson filed a lawsuit Monday in federal court in Green Bay, Wisconsin, against the Office of Personnel Management, an attempt to block the federal government from making an employer contribution to congressional health plans under the D.C. exchange.
Democrat supporters of this law basically made a covenant with the American people. They put on a pretty good show. They wanted to show the American people that they were eager, they were more than willing to benefit from the health care law, but also be subject to all the rules, all the regulations, until they really started thinking about what the true effect on themselves would be. And of course, that's when they went running to President Obama for special treatment, and they got it.
But Johnson's crusade is not going over so well with some of his colleagues, including members of his own party. Fellow Wisconsin Congressman Jim Sensenbrenner calls it, quote, a political stunt, saying in a statement, the employer contribution he's attacking is nothing more than a standard benefit that most private and all federal employees receive, including the president. This politically motivated lawsuit only takes public attention away from how bad all of Obamacare really is and focuses it on a trivial issue. Wisconsin Republican Senator Ron Johnson joins me now. Senator, thank you so much for coming to the program.
Good morning, Luke.
What's your response to Jim Sensenbrenner, who, from conversations I've had with some of your colleagues, is the one who spoke publicly about what many of them feel that this is nothing more than a political stunt and that you could increase the already problematic brain drain there is on Capitol Hill by making underpaid staffers even less paid and have to contribute a lot more to their health care?
It's not a stunt, and let's face it, every member of Congress has more than enough budget to be able to pay good people to do the work that needs to be done around here. So I respect Jim, but I totally disagree with where he's coming from on this issue. Let's face it, we are getting thousands of emails, heart-rending emails of the damage that's being done to real Americans, and until Democrat senators in particular start feeling the full experience of Obamacare, they actually start being forced to face the harsh realities of the damage of this law, they're going to continue to turn a deaf ear to those pleas of the American people that are looking for relief. So that's one of the reasons I think it's crucial that we end the special treatment for members of Congress. And the special treatment is they're going to get a tax advantage contribution into the exchanges that no other American is going to get. I mean, millions of Americans are losing the health care because of Obamacare. Members of Congress are also losing their coverage because of Obamacare. They're the only ones that get the special treatment of the pre-tax contribution into the exchange coverage. That's unfair, it's unjust. Yep.
Senator Johnson, I mean, this is something that is often seen in the private sector. I want to put up a graphic from the Kaiser Family Foundation. The amount of premium support that private employers usually give their employees for health care is usually about 82% on average. The federal government only pays 72%. You were a business owner. Did you pay your employees a premium, and what percentage was that?
Luke, absolutely. This is not about whether or not employers should provide coverage for their employees. What this is about is equal treatment under the law and following the law. Understand, it's very unfair that employer coverage gets a tax advantage, individual coverage does not. But that's the way the law is written. If you want to change if you don't like the law, you need to change it. You can't continue to change this law through presidential edict. That's what this is also about, that constitutional issue. So again, this is not frivolous in by any stretch of the imagination. This is a serious lawsuit. It raises serious constitutional questions, and it deserves a full and robust public debate.
It centers on an issue where many in your party feel the other way. I want to go back to October. Let me finish, sir. Let me finish, sir. October, an article in Politico. Just about Speaker Boehner's private fight for health care subsidies. During a 5-month period stretching from February to July, Boehner and his aides sought along with Reed's office to solve what had become a big headache for both of them. They drafted and reviewed a possible legislative fix, as well as continue to push for an administrative one from the Office of Personnel Management. So there you have the Republican Speaker of the House essentially asking for what happened. Is he wrong?
All I can say is every Republican except 2 voted during the whole government funding debate at the end of this fiscal year, voted for exactly the same result as would occur if I'm successful in my lawsuit. So they basically voted for a rejection of the OPM ruling. So publicly, everybody but 2 Republicans in Congress support my position in terms of the lawsuit.
I want to go to the issue of pay, because that's something that I think a lot of Americans don't realize on Capitol Hill. This is from the Washington Times. There's high turnover, low medium income. The average House staff assistant makes $30,000. Senate legislative correspondent about $35,000. House parking lot attendant $49,000. Under your plan, they're all paying significantly more for health care. Why should they? Making $35,000 a year or $30,000 a year answering phones. I mean, is that not sort of what they're signing up for, to serve their country? They're getting a little bit of a benefit on health care?
Luke, I'm looking for equal treatment under the law. And it's just simply unfair that any other American that had employer-sponsored care and loses it because of Obamacare, when they go to the exchange, if they qualify based on income, they'll get a subsidy. But if they don't qualify based on income, they're not going to get an employer contribution, a tax-free employer contribution. Only members of Congress and their staffs get that special treatment. That's just unfair. Americans have an expectation, a justifiable expectation, that Congress and the political class here in Washington should have to live by the rules and laws it imposes on the rest of Americans. This is an issue of basic fairness and also the enforcement of the rule and law. If they don't like the law, they should change it. We should not be running this country by presidential edict and fiat.
Senator Ron Johnson of Wisconsin, thank you so much for joining us this morning.
Have a great morning.